begin with health tonight, as what could best be described as a bold stand against malaria, a major public health challenge in the country. The federal government has formally inaugurated the Nigeria End Malaria Council. President Muhammadu Buhari, who performed the ceremony, emphasized that eliminating the disease remains a priority on his administration's agenda. State House correspondent Adamu Sambo has the details.
Despite the reduction in malaria prevalence from 42% to 23% in the last decade, records show that Nigeria still accounts for 27% of the 50 million global malaria cases annually and 32% of the nearly 100,000 deaths related to the disease. To end malaria in Nigeria, experts say continuous advocacy, coordinated actions, and sustained local resource mobilization cannot be overemphasized. And this informed the inauguration of Nigeria End Malaria Council, a public-private partnership initiative chaired by Africa's richest man, Aliko Dangote, to, amongst others, remove operational bottlenecks and resource gaps under the National Malaria Strategic Plan.
The establishment of this council is a great opportunity to ensure sufficient funding to protect the progress made so far, sustain the progress, and be on an irreversible pathway to ending malaria for good.
What is important to note today is that malaria is preventable, treatable, and curable.
Malaria vaccine promises to be a game changer within the malaria intervention toolkit, and Nigeria is expected to lead effort in Africa toward development of the vaccine and meeting the required financing obligation.
President Muhammadu Buhari, who inaugurated the council, said apart from causing severe disease and complication in pregnant women leading to high rates of miscarriages, malaria is also responsible for a considerable proportion of deaths in infants and young children under the age of 5.
The additional advocacy and funding the council will bring to the malaria control drive, we can anticipate a reduction in malaria burden that ensure that our children, pregnant women, indeed all Nigerians, are shielded from the disease. We must work together to reduce the unnecessary deaths attributable to malaria and ultimately improve the well-being of citizens.
The president described the membership of the council comprising a group of eminent personalities who have made their marks across all walks of life as a reflection of government's commitment to significantly reduce the malaria burden in Nigeria to a level where it is no longer a public health issue.
The successful implementation of the council agenda will result in improvement in the quality of life, health, and well-being of Nigerians by providing impetus for malaria elimination and by saving about 687 billion naira nationally, which is the estimated economic burden of malaria for 2022. The savings could increase to 2 trillion naira in 2030. A concerted strategy to tackle malaria, therefore, has both public health as well as socio-economic benefits for Nigeria.
Apart from the desired advocacy, the Nigeria End Malaria Council has a mission to also galvanize action and mobilize resources towards ending malaria in Nigeria by the year 2030. From the State House, Adamu Sambo, N2trn News.